Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the structural adaptation to weight bearing in the hip joint. So in standing or upright weight bearing activities, at least half of the weight of the head, that is head, arm and the trunk, or the gravitational force passes down through the pelvis to the femoral head, whereas the ground reaction force travel up to the shaft. So when the ground reaction force and the gravity act, so these two forces nearly parallel and opposite in direction create a force coupled with the moment arm. So this line represents the GRF, that is ground reaction force, and this line that is in downward direction represents the head, that is the weight of the head, arm and the trunk. So there is a perpendicular distance between two. This is a moment arm. So moment arm is equal to the distance between the superimposed body weight, that is head, on the femoral head, and the GRF, that is ground reaction force up to the shaft. So these forces create a bending moment or a set of shear force across a femoral neck. So this bending moment is consist of a tensile force which is act on the head of the femur and the greater trochanter. Another is a compressive force that is between the lesser trochanter and the femoral head. So weight bearing line of the head, arms and the trunk, that is HAT, loads on the head of the femur, where the ground reaction force come up to the shaft of the femur, resulting in the force couple that creates a bending moment. And the bending moments create tensile force on the superior aspect of the femoral neck and the compressive force on the inferior aspect. Next is the trabecular system. So due to these tensile forces and the compressive forces, femur bone has a trabecular system, which is consist of the first is the medial or the principal compressive trabecular system, second is a lateral or principal tensile trabecular system, and have others or secondary trabecular system, and there is an area that is a zone of weakness, that is no trabecular system is present in this part. Thank you.